Well, it's my pleasure to introduce Gerald Mckelvey with Exxonmobil, and it's been my pleasure over a long period of time to be associated with Exxonmobil. I've been so impressed with their business acumen, but also their commitment to improving the communities in which they live all around the world. And Gerald, I think, is a lifer. Is that right? That's right. There you are. What is a lifer? Is how many years? 30. Well, you know, I spent 30 years with McKinsey and Company. Those are like dog years. You know, it's longer than it sounds. But Gerald is the president of the Exxonmobil Foundation. He is deputy manager of public affairs, and the Exxonmobil Foundation has given more than $250 million in support of activities that range from things we've talked about today in education and health and environment, as well as the arts, community action and improvement. For example, they have programs that empower women and children in areas to help move themselves and their families out of poverty with better education and health, training in business, and also in terms of global health, the foundation has focused particularly in West Africa, where it's been, the company has been very active in exploration and production, refining, marketing, and working particularly in combating malaria and other infectious diseases very successfully and very creatively. With an eye on prevention, ExxonMobil has, of course, a very large research budget that has, in fact, it's said it's the largest non-pharmaceutical private sector donor to malaria research. Thanks to ExxonMobil, Rebecca and Michelle Fallon, who, Michelle, I guess you're tomorrow, and they were able to conduct successful clinical trials of their microscope to screen for cervical cancer in Nigeria, where this form of cancer is the leading cause of cancer death in women. So, Gerald, I think you're from Houston originally, Texas, close, and you have worked in all sorts of different places, I'm sure. Gerald got a degree with honors from U of H and got an MBA from UCLA. We're delighted to have you back in Texas and to be with us today.
Well, thanks for the introduction, and good afternoon or good evening to you. This has been, the last 2 hours for me has been an extraordinary learning experience, because as I travel and participate in conferences around the world, for me, as you heard Jim say, an MBA, I'm not a scientist, I'm not a doctor, I'm not a social worker, I'm not a public health official. I'm an MBA who spent 28 years managing various aspects of ExxonMobil's business around the world. And then I received a call, and some have later said perhaps even a calling, to become president of the ExxonMobil Foundation. And, you know, on my first day on the job, I had absolutely no clue what this activity was all about. And in fact, some of the program officers who work in the foundation, their first reaction was, "Oh my God, an accountant, we're in deep trouble today." But it's been an interesting 2.5 years as I've learned about our various programs and begun to actually shape some of the activities that we're involved in around the world. And so what I'd like to do today is really talk to you a little bit about the work that we do in terms of our foundation activities. And it does cover a fairly wide range of activities or focus areas, as we call it. And from my standpoint, it means that you never really become an expert at very much, but you learn enough to understand who are the leaders, who are the innovators, who are the activists who are deeply involved and who are making things happen, and in a sense are moving the needle in a very measurable way for people in the areas that we are focused in. As Jim said, the Exxonmobil Foundation is the primary philanthropic arm of the Exxonmobil Corporation. In the U.S., our primary program is to improve math and science education, particularly in the K through 12 system, where I think many of you are aware that the United States, based on current data, does appear to be falling behind much of the industrialized world in terms of the performance of our students when compared with their international peers. And so, as a result, we have developed a program announced on March 9th of this year called the National Math and Science Initiative, which has been set up to take some very successful local programs to improve K through 12 math and science education and try to scale them up nationally. And we've committed $125 million to this program, I believe the single largest corporate gift to assist public education in the U.S. We have a matching gift program which allows our employees to participate. We match $3 for every dollar that our employees contribute to higher education, and every year that program amounts to somewhere between $25 and $30 million flowing into higher education in the United States, and it's a program that we're quite proud of. Now, when we move outside the United States, the Foundation supports programs to increase access to education and microfinance and to increase the vocational skills, especially for women and girls in developing countries. And I was certainly enthralled with your comments, Dr. Baines, and I'd like to talk to you again about some potential activities where we may have a mutual interest. But on balance, and I guess I should say that we have other programs to support programs to combat malaria, as you've heard, and I'm going to talk a little bit about malaria and why we're involved in it in just a few minutes. We're also very deeply into programs to alleviate poverty and in generally to improve the living conditions and other social indicators in communities where we operate around the world. And we'd like to say that on balance, our programs represent demonstrable actions supporting the corporation's objective to promote societal progress and economic growth in communities where we operate. I'm going to come back to two programs, one that we call ExxonMobil's Africa Health Initiative, and the second, our Educating Women and Girls Initiative. But first, let me provide some background to our notion of corporate citizenship. ExxonMobil's primary responsibility is to produce the energy that the world needs in an economically, environmentally, and socially responsible manner. This is a global challenge. Our approach to it is very pragmatic, and many would also say very profitable. And we do have a long-term perspective on our business. We recognize that how we achieve results is as important as the results themselves. We manage our investments and our operations with consistency, with integrity, discipline, and reliability. And this is just not just corporate speak. It's central to the way we do business around the world, and it's key to achieving long-term sustainable performance and also good corporate citizenship. Now, throughout our 125-year history, we've had a tradition of contributing to the communities in which we operate. And to give you a sense of the scope of our operations, we now have a presence in more than 150 countries around the world. The corporation's operations generate good jobs, wages, and benefits. We employ more than 82,000 people and utilize more than 175,000 suppliers and contractors around the world. We provide competitive returns for our shareholders. And in the year 2006, and if there's a number that I want you to remember from today, we paid more than $100 billion in taxes to governments around the world. We also help our host communities grow and prosper. And our employees are quite active in a number of volunteer programs. They contribute their time, they contribute their talent, and they contribute their money. And along with the contributions of the corporation and the foundation, we each year manage programs totaling more than $200 million in charitable and philanthropic activities around the country. So ultimately, good corporate citizenship raises the standard of living and promotes the stability of communities and enhances our long-term success. Our philosophy on corporate social responsibility parallels the aphorism, you can't have a successful business in a failed world. And in no place is that more applicable than in Africa, which is the topic of your discussion today. As many of you who've worked in Africa, you know that there is economic development underway. Much of it is related to natural resources development. The continent provides needed crude oil supplies for the world markets and is a principal supplier to the United States. The continent benefits from the investments, technology transfer, and employment and taxes paid by industry. In fact, Exxonmobil is one of the largest private investors. We may well be the largest private investor in Africa, with nearly $20 billion invested on the continent. And the continent is a significant growth area for our company. Over the last 5 years, about the amount of oil that we produce in Africa has grown to about 1/4 of the total oil produced by Exxonmobil globally. And we continue to invest quite heavily in Africa. We have more than 5,000 employees and 10,000 other direct suppliers and contractors who call Africa home. Others visit regularly. And we're well aware of the development challenges the continent presents. We also recognize the unique role that corporate foundations such as ours can play in addressing critical societal needs. About 5 years ago, predating me, the ExxonMobil Foundation decided to increase support of programs to reduce known barriers to development in countries where we operate. So this was really our first foray into these activities. Our social investments take their cues from the UN Millennium Development Goals. You've heard much about that from Dr. Adewale. Thank you for that coverage in your discussion, as well as from local community initiatives. And we think this is a win-win situation. It's good for global progress and for individual communities, and it helps ensure a stable operating environment for companies such as ours. Now, community investment initiatives, in our view, are most effective when we as corporate philanthropists and program supporters can take advantage of opportunities for collaboration across government, non-governmental organizations, and the private sector. Achieving effective collaboration can be, or I should say is, very difficult. But we believe it's a necessary condition if we wish to achieve lasting positive change in the less advantaged communities around the world. Effective collaboration also requires a general alignment of the resources and contributions of the partners. And sometimes, and this is kind of a key point to what I'll talk about later, the significance and the relative value of corporate philanthropy is often highly misunderstood. The media and others tend to look at the dollar figure of corporate contributions. How much money did you contribute? Rather than the value that can be realized from access to the leadership and the technology, the management skills, and the business core competencies of these organizations. The most successful partnerships are ones in which the strength of each partner is fully understood and is leveraged. The strength of ExxonMobil is not simply in the financial resources it can contribute. If we work in areas that are consistent with our core competencies, it's also tapping the very much world-class managerial and technical competencies of the organization to solve some commonly understood problems. From the standpoint of grant recipients, we think as much as possible you should seek to align your requests with the partner's philanthropic mission and objectives. But consider how the funders can affect changes in areas such as global health and development beyond simple check writing, as I mentioned. For example, in one of our key partnerships, we utilized our managerial competence, our chemical engineering technology, and even our distribution system in the fight against malaria. And I'll talk again about that in just a moment. And just maybe a final comment on this, the truly successful corporations align and live their values in the workplace, the marketplace, and in the communities where they live and work. And in doing so, they can actively apply their core competencies to address social issues. Now, let me take a few moments to describe how we develop many of our programs. We call them corporate signature programs. And I guess that's because we always use the term ExxonMobil just to differentiate it from programs offered by others. There are many organizations active in health in Africa. our Africa Health Initiative, as I'll talk about, is primarily focused on malaria. And I'll tell you why in just a moment, but it does offer the flexibility to engage other areas, as I'll also mention. We created 2 programs in focus areas that we believe are fundamental to our specific business: Africa Health and Educating Women and Girls. And let me tell you about those, because I'm sure you're curious as to how we decided to focus on these issues. Now, it's been mentioned already, the fight against malaria is one of the UN Millennium Development Goals ratified by, and Dr. Adewale, my notes say 190 countries. I noticed that yours said 189, so we need to find the outlier. And we certainly think that, solving the malaria issue is one of the key actions in breaking the cycle of disease and poverty that burdens countries in Africa. As a company with as much money invested and as many employees and suppliers and visitors, and including myself, who visited Africa and several countries in Africa on many occasions, we don't think we can sit idly by and accept the loss of productivity and human potential that comes with 1 million people, mostly pregnant women and children, dying every year from malaria. Because the mosquito does not respect company fence lines or national boundaries, we believe that making progress against this killer disease requires country and continent scale collaborative responses. Malaria can be treated in the individual. However, malaria, as I know that you're aware, is a disease of communities, and it needs a local, a national, even an international response to stop its transmission. And we think this must include the business community. We should not be left out of these efforts. In our part, we've committed our resources to deploying our business leadership and know-how to roll back malaria and save African lives. Over the past 6 years, we've invested something over $30 million in malaria projects in 16 countries. Doesn't seem like a lot of money, but let me talk a little bit about some of the activities. Now, many of these projects apply our core business competencies, and many in partnerships with some of the distinguished individuals here and in non-governmental organizations across the world. And primarily, or at least our focus initially, was to make life-saving commodities available, commodities primarily being bed nets and some of the meds that have been developed, and make them accessible to vulnerable groups. And our focus is primarily to save lives. And one way we're involved in the fight is by employing experts in the field. And we're probably one of the companies, as I said earlier, and as Jim said in his introductory notes, I work for an oil and gas company. But we actually utilize our own in-house experts to proactively foster some of the global partnerships and to lend technical and managerial assistance to this effort. Let me give you one example. Dr. Stephen Phillips, perhaps some of you may be aware of him. He's an expert in public health. He helps lead the Exxonmobil Foundation's and our corporation's efforts to address malaria as well as other global health concerns. 26 years ago, he was involved in the early fight against what became known as AIDS, as a public health official in New York City. And we're quite proud to count him as an employee of the company. His long history of research in epidemic diseases, he works closely with governments, with NGOs, UN agencies, multilateral organizations. He currently serves as one of the 2 private sector representatives on the board of Rollback Malaria, and he serves as part of the private sector delegation to the board of the Global Fund for AIDS, Tuberculosis, and Malaria. He provides a critical link to the global health community and has helped shape our entire work and focus in this field. Now, early on, Stephen counseled us that we needed to tackle the challenge of malaria head-on first in our own workforce. So we put in place a comprehensive workplace malaria control program that covered every one of our African employees. And I can now report that over the past 3 years, we have recorded exactly 1 case of malaria among our expatriate employee population, and no cases of serious malaria in our national employees. And that involves more than 12,000 person years, in a sense, at risk in terms of the way we measure it. So we think, certainly within the Exxonmobil operating facilities, that the same kinds of programs can work. We think malaria can be beaten, but what will it take on a global scale? Organization. Let me give you a few perspectives from a business perspective in terms of our on-the-ground experience in malaria. First, in the energy industry, we operate under the belief that if you can't measure it, you can't manage it. And we apply the same principle to malaria. We encourage our partners to make the fight against this disease as transparent, as accountable, as integrated, as efficient, as process-driven, and performance-oriented as we run our own business operations. Second, we know from malaria experts that this disease is preventable and curable. But in an era of increased resources and political will and even more effective tools, we have to ask ourselves, why have we not stopped this disease? Once again, we think the missing link is organization. The malaria parasite thrives on disorganized human systems. Conversely, it can be defeated by collaboration. And this calls for organized planning and logistics to deliver life-saving interventions to the front lines of those who are at risk. And third, we frequently hear when addressing some of Africa's intractable development issues, as they're sometimes described, that no one sector, government, or institution can solve the problem alone. And we submit that this is not a conclusion, but really just a problem statement. So in our business, when we reach a similar position regarding a business opportunity, we frequently share the risks and rewards related to a common objective by forming a joint venture partnership. This is an approach that global health players might consider. In fact, we encourage you to consider, to make themselves accountable to each other in achieving results. So we would conclude that partnerships are the key to breaking the chain of this disease, and that's partnerships between governments, between non-governmental organizations, between local community organizations, and all elements of the business community need to be engaged in the fight. For example, just talking about some activities or programs we've utilized within Exxonmobil's Africa operations, we actually pioneered the use of our retail service station network in 4 African countries and used them as a platform to distribute long-lasting insecticide-treated bed nets and the related health and education or health education information. We assisted with the transfer of technology as part of a 6-member consortium to launch Africa's first, and I still believe only, textile factory that produces long-lasting insecticide-treated bed nets. We've been in full support of President Bush's malaria initiative and also the government of Angola through 6 projects. And our partners on these projects have included UNICEF, Population Services International, the United Nations Foundation, World Health Organization, Safe Blood for Africa, the Measles Partnership, and many others. So if there's a message here, we don't try to do this by ourselves or even with one partner. We seek an integrated group of partners, each with their own strengths and capabilities, to try to deal with these very complex problems. We funded proof of concept research in a number of countries designed to address, I think this is a U.S. term, the last mile challenge. You know, the problem is we've got to get the commodities to people who need them, no matter how remote the location. And we also need to foster health-seeking behavior in these people who are not always in contact with health officials. We work with the Measles Partnership to show that the distribution of long-lasting nets can be inexpensively piggybacked to complement mass country-scale measles immunization campaigns. So once again, we found an effective campaign that was underway, and we said, why not also handle or deal with malaria? And this approach has been used to distribute over 10 million nets this year to children under the age of 5. Now, I'll just briefly mention one of our other successful partnerships that's beyond the malaria fight, because I think you've heard a little bit about it, and we'll hear much more tomorrow. And it's a partnership with one of our colleagues here in the room, Dr. Michelle Fallon. And since late 2005, we've supported Dr. Fallon's efforts to bring modern technology to improve the early detection and treatment of cervical cancer to the people of Nigeria. and I think you'll be given a vivid description of the project. Now, this project enjoys the support because it's a project that started here, frankly, in Houston, Texas. It started because one of our senior executives made a comment to me as he was about to retire that he said, "Gerald, you need to maintain your relationship with that very much world-class organization over at MD Anderson." When I called MD Anderson, I said, well, here's what we're doing. Let's go back to foundation, focus areas. Where are we working? We're working in Africa. We're trying to deal with some diseases in very difficult parts of the world. Our focus is malaria. So what do you cancer guys know about malaria? That was that's a true statement. and being an MBA, I don't have a clue. So in our discussions with MD Anderson, we found a couple of areas of common ground. The first area of common ground, which much to our surprise, was that MD Anderson was working in Africa. And we said, wow, this is good. So what are you doing? He said, we have a program to start testing some modern equipment to see if we can't figure ways to diagnose and treat cervical cancer. Now, when I talked to the Exxonmobil Foundation Board of Trustees about cervical cancer, their response to me was, but that's not malaria. I said, I know, even an MBA knows that it's not malaria. But the potential and the promise of the program, one, being in a very key country, and we've talked a lot about Nigeria. Let me give you a couple of other facts about Nigeria. When most of you, how many of you came today and you drove your own personal automobile? Okay. Well, how many of you were aware that about 15% of the crude oil that's imported into the United States comes from Nigeria? Okay, that's pretty good. That's about half of you drove your own automobiles. About half of those actually were aware that a demonstrable percentage of our crude oil imports are from the country of Nigeria. The country is very important in a strategic sense to the United States of America. As we worry about the geopolitical risks in the Middle East and the prospect or potential for curtailment or shutdown of oil supplies, which could fundamentally change the character of the United States economy and the way in which we live, we have a country that so far, despite its difficulties and despite many of the troubles that they're trying to deal with, has been a reliable supplier of energy for the United States. It is a very important country to us. What happens in Nigeria should be of concern to us. And I don't think I can make that statement any more clearly. So the point I'll get here is that we try to deploy the best of what we can do as a private sector company to the fight against malaria and increasingly other diseases, as we have also gotten involved with cholera and Marburg and cervical cancer. I won't say that we can have the capacity to deal with all diseases, all of the issues, all of the problems. We certainly don't. But when we decide to engage, we provide our project and issues management expertise, our chemical and mechanical engineering know-how, our monitoring and evaluation techniques, our logistics and distribution systems, our marketing acumen, our financial resources, and even the convening power that comes from being the world's largest energy company. And in this way, the Exxonmobil Foundation work supports our business, and together with the business activities of Exxonmobil Corporation, we support the fight against disease in developing countries. Let me turn very quickly to the last program here, which is educating women and girls. And we heard quite a lot about the issues, the effects of HIV/AIDS on women, and also about just the issues of development as they relate to women and girls. And we read a World Bank report a couple of years ago that made a very simple and compelling comment that the most effective way to promote development and promote improvements in all of the social indicators in the developing world is to invest in women and girls. It's kind of an interesting comment. I mean, my company, let's face it, is kind of a patriarchal society, and so for us, I'll say, to sit back and say that, well, we're not approaching what we're doing in many of these companies in quite the right way, and we need to look at it differently. And in looking at it differently, we created our own Educating Women and Girls program. And we focus our grant-making program directly on helping communities improve and enhance opportunities for their women and girls. You know, we see the unique challenges that they deal with every day. We also see that women, in many cases, are among the most productive parts of society in many of these countries, and they deserve a better chance, and they deserve the opportunity to improve. I've got a paragraph here I need to read. Is it Dr. Baines? Ms. Baines. Well, he sounded like doctor, so. The children of educated mothers are more likely to survive, go to school, and live healthier because of higher nutrition and immunization rates. Educating women and girls lowers infant and child mortality rates, prevents diseases associated with poor sanitation, and helps contain the spread of HIV/AIDS. Now, I read mine verbatim, you did yours, but it is so consistent, the story, when you hear it, and it makes a very compelling story. So the key to our success in this area will continue to be our partnerships. We'll continue to partner with non-governmental organizations, with local communities, host country governments, other companies, which is kind of a new feature here to see two competing companies in a country actually collaborate to promote societal progress. And you know, more to come on that as we try to figure out ways to work more closely with the Chevrons and BPs of the world. I'll tell you about one project in Angola that I'm particularly proud of in our Women and Girls Initiative, and it involves the construction of primary schools. And everyone, I think, probably saw the news report on Oprah's school in South Africa, and I think it's absolutely tremendous. It's a leadership academy, and she's obviously trying to educate a new leadership for South Africa, and these are girls. Our schools are on a much less elaborate scale. We actually have been able to put more children in school. I think Oprah has about 600 girls in her schools. We're working on about 10,000 now that we've provided schools for in Angola. And they're not expensive. They're 3-room blocks. We build them. We furnish them. Perhaps we put a power generator there. But the interesting part about this is we've been able, again, it's based on partnerships. Save the Children is involved, Project Hope, which, because at each school we're also adding a health clinic, a medical post for at least the distribution of commodity drugs and insecticide-treated bed nets. And a new organization, or I call it a new small company called Sunlight Solar, which is Houston-based, and they have developed, we think, a very innovative lantern, which is solar-powered. So in much of the country, there is no power generation, there is no electricity, and so when the sun goes down, not only is school out, but there's no opportunity to study. But with these solar-powered lanterns, which can be left in the daylight to charge and then can be used at night to provide light, the children of Angola are actually able to study once they leave the school. So we think it's a tremendous program, and once again, it takes a lot of time to bring together all the partners, but it's been very significant for us. Let me conclude. We know the challenges facing the developing world require us to engage with people who understand these issues. We don't purport to understand all the issues, but we do want to know who you are. People like you, the visionaries and the practitioners, as well as local leaders, need to know the needs of these communities. We will sustain our commitment to continue to work in these areas and to use the most effective approaches to address these challenges. And by aligning our philanthropic efforts and core business skills with capable partners, we think we can make a positive impact on global health and economic and social progress in the most needy parts of the world. I thank you for your time and attention, and if there's a question.
We have time for just one or two questions.
teachers come from in Angola?
The teachers are Angolan nationals. It's interesting, and without taking too much time, as most of you know, Angola has only recently emerged from some 27, almost 3 decades of civil war. The country was virtually destroyed. Certainly the interior and the remote parts of the country, there's all the infrastructure was destroyed. Now they do have a significant rebuilding program going on. But most of the teachers in our schools themselves only have the equivalent of a 6th grade education in the U.S. And so the next program that we are about to undertake is a teacher training program to actually help some of these teachers, mostly women, to acquire a higher level of competency so they can be more effective in teaching their students. So,
some of the programs that you are executing are not well advertised. Is it deliberate to keep things under the table?
Well, advertising has a double-edged sword. One, you make people more aware of what you're doing, and don't get me wrong, we don't go out of our way not to tell the world what we're doing. I mean, most of you, did you not see the national advertising, the national announcement we did on the Math and Science Initiative in the U.S.? We had advertising during the Masters Golf Contest, the golfer Phil Mickelson swinging a golf club with math equations springing out. So, and one of the problems, and I'll just say this bluntly, you said you weren't the minister. I'll speak not as the president of the foundation, but as an employee of Exxonmobil. And one of the problems you get into here is you end up, to make some of these programs better known, you end up spending more money on the public relations than you do on the program itself. And I, for one, reject that approach and philosophy. I think the programs need to stand on their own. If we are as effective as we can be, I mean, eventually the word will get out. And certainly as I travel and try to meet many of you, I'm always exchanging business cards and looking for new opportunities. But, and I think even in Nigeria, I thought that we did have some broad advertising of the cervical cancer program, but perhaps not as much as...
We did.
Yeah, we did. We didn't, but they don't have as much advertising of the malaria program.
Okay.
And so, yeah.
Only thing I can say is that today, either yesterday or today, in the New York Times, we're running an op-ed on malaria. It's the 8th op-ed that we've run on malaria and the issues of malaria and fighting malaria. We were mentioned on, and I almost hate to say some of this stuff, but we were mentioned on American Idol because we have a program with American Idol has a segment of their show called Idol Gives Back, and they are mounting a program to raise money for malaria. And the Exxonmobil Foundation is going to match the money that Idol raises for malaria. So, we do what we can, but we don't want to overplay the public relations side of this because I think it's more important to be perceived as someone who's interested in doing this for the welfare and benefit of the people in the communities where we operate, not for the public relations benefit of Exxonmobil. If you think well of us, hopefully you'll think well of us because of a continued good works over a long period of time, and not because we mount a single large public relations campaign. Okay, thank you.
So in just a moment, we're going to adjourn to a reception out in the lobby, which will feature, I think, a very wonderful media display that was put together by Professor Kirsten Oster, who is an assistant professor in the Department of English here at Rice University and specializes in the role of film as a way to communicate about health issues. But first, I need to do 2 important things. One is to thank all of the speakers today for their really inspiring talks. I think it was just a fantastic group of talks. The second thing that I'd like to do is recognize all of the hard work and contributions of 2 very important people who helped put this meeting together, which are Kirsten Matthews in the Baker Institute and Yvette Mirabel in the Beyond Traditional Borders program. Thank you so much for all your efforts.